Hello, good afternoon. Thank you for joining us for this month's QTECH committee meeting. We're going to get started in just a couple more minutes. We'd love for you to participate in today's polling event. So as you can see, there's some instructions on the slide, and what we're asking today is for you to participate in the poll. What was the last population you targeted for a patient engagement campaign? So there's a couple options you're going to see shortly pop up on the screen. Oh, fantastic. And we already have folks participating. It seems like diabetes is a very popular population to be targeting. We'll want to hear more about that. So please participate and we'll get started in a few minutes. Hello, welcome. Thank you for joining us for this afternoon's QTECH committee meeting. We're going to go ahead and get started for today's session. As we normally like to do, we like to review our webinar logistics, so ways for you to participate during the session. So just so you know, you have joined this session in a listen-only mode and are muted by default. But to participate in the interactive Q&A via the telephone, you'll need to make sure that you have entered the PIN number. You can also use the questions panel throughout the webinar today just to share any questions you might have for our presenters this afternoon. And of course, this session will be recorded for you to revisit after the session, and thank you for participating with us today. This is just a slide to highlight, of course, the QTECH goals and reaching our goals together. We have a fantastic group of health centers that are all working together to reach some of these milestones. So thank you again for taking the time out of your busy days to join us. Really briefly, we're going to go ahead and look at the agenda for this afternoon's meeting. We're going to look at the interactive poll questions, so those instructions will be showing up shortly. We'll take a look at the responses to those and then hopefully see if we can have someone unmute and maybe share a little bit more about that patient engagement program. Afterwards, we're going to then transition to our first Health Center Spotlight today with BCOM, who will be talking about the EPIC Humana Foundation program that they have in place at their health center. After that, we will then hear from another Health Center Spotlight that's focused on childhood immunizations with Community Health Centers of Pinellas with Dr. Kitterman. After that, we'll round out today's session with a review of some social determinants of health resources, and then do some announcements and wrap up for today's session. So on the slide here, we're looking at the instructions for how to participate in the interactive polling that we have for today's session. So there's two different ways to participate. One is using the web. So if you go to the website link that we have listed here, www.pollev.com/QTECH, and enter your response. Or you can even participate using your smartphone. So in order to participate using your smartphone, you want to go ahead and address the text message to the phone number 22333. And in that message, you want to type QTECH. Once you've submitted that first message of QTECH, you'll join the room and be able to then provide your response. So without further ado, I'm going to transition to the poll question that we have for today. So as you know, throughout the last couple of QTECH committee meetings, we were able to have our high-tech partners join us to talk a little bit more about electronic patient engagement and different ways to implement tools to support those efforts. So what we wanted to do today was ask a poll question related to the last population you targeted for a campaign. So for patient engagement. So it could be diabetes for A, preventative cancer screenings, ending the HIV epidemic, cardiovascular disease, or other items. So with that, we'd also like to see the results and see if we can unmute and have you share a little bit more about that campaign itself. So let's take a look here. Pause the screen. Fantastic. So looking at some of the results here, it looks like there is a big focus on diabetes. So about 80% of folks have targeted their diabetic patient population as that campaign. So that's fantastic to hear. I'm gonna actually take a look at the chat and see if anyone wants to unmute themselves and share a little bit more. I also see folks participating in the chat, so thank you, Daisy. She mentioned colorectal cancer screening specifically. Okay. We're gonna unmute the lines and see if anyone would like to share. Would anyone like to talk about what specifically they're doing for their diabetes patient engagement campaign?
Hi, Stephanie. This is Alex from Broward Community Family Health Center.
Hi, Alex.
How you doing?
Great.
Hey, so for our center, for BCOM, we actually do a couple things here. We have a pretty stringent QI program, and so we work closely together. We review the data with our providers, and we kind of show them where where to move the needle, how to move the needle, in the sense of how to document, in the system. And so we also partner up with some of our outreach teams, which they identify and work directly closely with our diabetic patients, and they'll enroll them into programs, and we'll get them into the visits so we can get their tests done on time. And so that's just some of the things that we do. Without getting too much into detail, we also do outreach by way of text message, and that seems to get us a lot of results back. Getting them to come back into if they haven't done their test on time. So we use technology in that way to get a hold of them, and we see that there is a big group of folks that do respond back by way of text. So yeah, that's what we do.
That's
Hi, this is Emmy
fantastic.
from Banyan. Hi. So one of the things that we're doing is for cervical cancer. We've basically run our dashboard, and we pulled the data by provider and which individuals are missing their pap smear. And so we have our care coordinators who are checking to make sure that, one, we don't have the cervical pap smear in our system, because I know last year we had some issues with Quest and some of those not going directly into our system. So that's one thing, making sure that we modify those results from the previous year. And secondly, we'll go ahead and schedule that visit as a PAP visit. So we created a new appointment type that's called PAP, so that when the provider sees it, they know for a fact that that person is coming in for a PAP smear, and we don't deviate from the course. So nonetheless, that's what we're focusing our efforts at this time, is our cervical cancer screening, in addition to others, but that's the one that we're mainly focusing our efforts on.
That's fantastic. Thank you, Emmy and Alex, for both sharing that. Would anyone else like to share a little bit more about a patient engagement campaign that they're doing to reach out to patients?
This is Allison from Conwell. We actually did, back in the fall, we had a little bit of money from the Cancer Society, American Cancer Society, related to colorectal cancer screening. So what we did is we did prepared a flyer that explained the 3 different ways to test, like the Cologuard, the colonoscopy, or the FIT test, and we mailed that out to all of our patients who were non-compliant. And so we did see a little tick up in that. So patients were calling and asking for those referrals. So that was something we did.
That's fantastic. Thank you for sharing, Allison. That also makes a really important part about how community partnerships play a role in the different campaigns that you have with your patients. So that's fantastic.
It was great because the student did the work and they paid for it. So, they designed it and printed, so stuffed the envelopes. It was, low tech, but very fruitful.
Fantastic. All right, so I think that's a great, thank you so much for sharing that. If you want to continue putting things in the chat as well, we'll be monitoring that to share it during the presentation today. But I want to now pass the floor to our first Health Center Spotlight. So with us today, we have a couple different representatives from Broward Community and Family Health Centers, so BCOM. We have Dr. Major Moore, we have Jerson Dulis, and Mendy Figueroa, who's going to all go over the program and how it's impacted their ability to address social determinants of health. So let me go ahead and make sure the screen's up. Okay, and the floor is yours.
Thank you and good afternoon. Thanks again for having us this afternoon, and it's a pleasure for us to be able to share this program and make this connection with the other health centers as well as HCN. I'll just be introducing the group really quickly, but I did want to make the note that I know you all are looking at the word epic. Is something we're starting to realize that we're going to have some major competition with the name. As you can see, it means engaging patients, impacting care, and it seems like our new epic system or software platform is going to be confused with this one. So we'll be working on a way of identifying that without making that conflict. But with us this morning, this afternoon, we have Dr. Major Moore, who is our clinical director, and we're thankful that you were able to take some time from the patients to be able to present and share what you've been doing to help our patients through this program. And we also have Mendy, who is our program coordinator, who is, this is her baby. She has been so valuable to this program and knows the ins and outs and is hands-on on this program. And I definitely also want to give a shout out to our consultant, Caprice Brown, who is on the observing side. He's not here presenting, but he is a major backbone of this project as well. And of course, Alex Dueso, or director of IT, who helped us build so much of this. And I found out that he is listening in as well. But with that said, I'll open the floor. I'll pass the floor on to my colleagues, Dr. Major Moore and Mendy.
Thank you, Jerson. Such a warm welcome. Thank you guys for joining us. I'm really excited. As Jerson mentioned, I am the program coordinator here at Broward Community and Family Health Centers, now known as BCOM. This has been a very exciting program. And before I continue, I do have to apologize just in case I am in and out. We are having some unstable internet connection issues. But again, I am very excited to join everyone today and to be able to speak a lot in detail about what we are doing and what we've been able to do with and through the EPIC program. And if we can, we can jump right into it and go into the next slide. So BCOM, like I mentioned, Broward Community and Family Health Centers, we are committed to providing high quality care and preventative services and health education. Again, primarily one of which is the EPIC program. We are focusing on mainly 3 interventions. Again, I did want to give a brief overview of that, but I'll let Dr. Major Moore take the floor, and we'll just be going back and forth in terms of really being able to explain it in more detail. And if we can, yeah, there we are.
Okay. Hi, everyone. Thank you so much for joining us and for allowing us to speak on this. I'm sure everyone on the line, especially the providers themselves, we're faced daily with situations where chronic diseases are so heavily, that we treat, are so heavily impacted by the social determinants of health. And that is what EPIC is targeted. So Broward Community and Family Health Center has incorporated social determinants of health, focusing on 3 in particular: food insecurity, chronic diseases, social isolation. Those are the focus. There are other social determinants of health, as you know, education, housing, and so forth. These are the ones that this program focuses on. And BCOM has incorporated these into our health centers practice by screening patients for these particular 3 interventions from the beginning, from the front door, and then following up on it from the back end. The food insecurity component focuses on improving patient food security through the SNAP program and through referrals to local pantries. The chronic disease section focuses on things such as diabetes, high blood pressure, high cholesterol is not listed here, but is of course included, and referral to health center dietitian for meal plan assistance. We're fortunate enough to be one of the few health centers that have a nutritionist on board that is actually also a diabetics educator. So we're pretty fortunate in that. So we have a health center dietitian for meal plan assistance, the OTC card for the purchase of fresh fruits and vegetables. And then the behavioral health department now, they focus on the social isolation aspect. As a part of enrollment in the EPIC program, transportation and copay assistance is readily available. And there's transportation services for all of BCOM's sites. It's utilized by all 4 of the medical sites, as well as our dental site as well. Next slide, please. So let's talk a little bit about how the workflow and what we mean when we say from door to end. Mostly what I know is the end part. My part is the easy part. I get to say that because I feel like Mindy's part and all the front desk people, their job is really much harder in this respects, you know. From the front door, the patient arrives at the health center, right? They sign in, they complete their form. A screener is assessing for food security and social connection. And that part is important as well. You know, not all of our patients have the same level of literacy. And so having a conversation with them and figuring out where they are and then meeting them there, that part is really important. So that screener becomes extremely important. Then the physical forms are completed. And that's split up by the front desk section, as well as the outreach department and the behavioral health department, right? So that's completed. The outreach section gets the initial assessment with all the patients who screen positive for food insecurity. Then the patient is referred to the EPIC program by the provider. And anything that screams social isolation, that automatically goes to behavioral health. Now, even if it's not immediately positive for social isolation, once they go through and outreach does their part, they can still be referred out to behavioral health so that it doesn't go away. The outreach department then identifies if the patient has any chronic conditions and assigns the OTC card or incentive for the fruits and vegetables. And then they conduct 3 and 6 month follow-up to assess, measure, and compare patients' improvements from baseline. Now, what does the providers do on the back end? On the back end, when I see the patient, okay, oftentimes you'll hear, well, the reason that I'm not eating the way that you want me to is because I don't have the kind of food, or I can't afford this kind of food, or this happens. You know, we're all familiar with the patient telling the medical student one thing, then they tell the resident something else. Then they tell the attendant something else completely different. This is no different. They'll say one thing to the screener or to the front desk, and then they'll say something completely different once they get into the room. And some of that is due to embarrassment. So once we have that conversation, even if they screened negative at the front, we can still send a task, and Gerson and Mindy are always available to fix it for us. So that they're super helpful. When I say that they have the hard part of the job, I'm not kidding. If the patient has diabetes or high blood pressure, they're not able to get food, fresh foods, or so forth, we send a task, and if they had fallen through the cracks at the front, Gerson and Mindy will get them from the back end. So that's another way that we correct for that. Next slide.
I couldn't have said it better, any better myself. And just kind of going a little bit more into, you know, some of the ways that, you know, us as the outreach department, that the ways that we will identify if whether the patient has a chronic condition. So if we have that screener in front of us, sometimes it starts off as a conversation. Other times it might not be a conversation, and we'll identify if whether that patient has a chronic condition through our EHR, and then be able to you know, facilitate a conversation between the patient and ourselves and encourage them to enroll into the EPIC program, and why, you know, sharing the benefits of why the EPIC program would probably be the best route for them. Again, we don't just enroll, we do also do follow-ups. The follow-ups are very, very important here, because we want to be able to walk the patient through their improvements also, and help them to really empower them to really be able to monitor their improvements and even want to be a part of the EPIC program again. So we are in our 2nd year, and we have had many patients who have been a part of the 1st year, you know, want to be enrolled again and want to see more improvements in terms of what they can do, because they've seen the benefits in year 1, right? So thank you, Dr. Major Moore. You can go ahead. Sorry.
Engineer 302, Engineer 302.
Okay, so some of the challenges, and I'm sure the first one, COVID-19 and quarantine ordinances. So this is a challenge not only for the health center, but for the patients themselves. A lot of our patients lost their jobs, and this is why they even need the program in the first place. There's a lot of anxiety and depression and isolation, and that's increased a lot. So the EPIC program has become increasingly important during the pandemic. Okay, the primary contact, though, that the health center has with patients is by phone as opposed to in person, and that's what it is for now because of COVID. Okay, so, you know, we are used to the days when people walk into the health center at will, but that has had to be modified because of COVID. And now our primary contact with patients is really to conduct screens is really
by phone as opposed to person. As far as immigration, there's been a decline in SNAP due to immigration status. So educating patients about USCIS and why public housing and Medicaid or SNAP are a part of the public charge and admissibility criteria. That's also not an easy conversation to have. So that's also a challenge. I mean, it's already challenging enough to try to talk about immigration status with patients because oftentimes they're fearful. So that's an additional barrier. Then having our EHR data capture limitations. That's also a challenge. Alex is amazing. So I'm really glad he's listening because I feel like all aspects of BCom heavily reliant on Alex. So thank God for him. The really overcoming that was based on creating a web application to streamline the enrollment and then to expand the data entry capabilities. And that's all Alex's section right there. So anyone with questions regarding that, I'm thankful Alex is on the line.
Right. So, and that's all true, very true. And so in light of, again, being in our second year of EPIC, in our first year, we have had to overcome, these challenges. Mainly, I would say these were like the really big challenges for us because COVID-19 hit, and then we went from screening patients in person primarily to having to do it over the phone, right? Finding ways to, how can we do this? How can we continue screening without completely stopping and or pausing the program in any way? So we definitely did it by taking it from in person to over the phone. So we completed the initial screenings, which is asking about food security, social isolation over the phone. We completed extended surveys over the phone. We enrolled patients into either any of the 3 interventions which they qualified for over the phone. So people were still able to enroll and actively get the help that they need, even during a pandemic, right? Another challenge was definitely SNAP and really being able to educate our patients on why they shouldn't be fearful, and that went into educating ourselves, right? So as a health center, we had to really kind of go into well, this is definitely a valid concern, right, amongst our population, and so how can we better help serve them? So that went into educating ourselves as well as our patients on why it is that they can go ahead and apply for benefits, why they should allow us to help them apply for benefits if they're in need, because again, that is part of the program, enrolling patients into the SNAP program if they are food insecure. EHR data capture limitations. So just as Dr. Major Moore mentioned, Alex has been, at the forefront and really helping to push some of the technical components of the EPIC program. And so we're grateful for that, but it definitely was a major challenge in the first year because we found ourselves wanting to document everything, right? So we would talk, just as an example, we would speak to patients, and so they would tell us why they probably couldn't get SNAP. And so because we had a free text field, we weren't able to kind of put in everything to really tell the story. So with that, we thought, how can we make this, how are we going to make this better for the second year? And with that, we have a EPIC web application built specifically to house that information, to be able to expand the data capabilities and capture the story, the essence and the story of what we're doing, why we're doing it, and how we're helping the patient. We can move on to thank you so much. And so with that, if you I want to say in the first year, this is really capturing the first year, what we were able to do. So again, Cheers to a Healthy Start is one of the components, really highlighting that in our brochures when what we provide to our patients. So in our first year of EPIC, we were able to screened 4,855 patients for both food security and social connection. That's really, really big for us because we did say that we would screen 4,500. So we definitely met and exceeded that goal. In our second target, which is to help improve food security, we enrolled 1,284 patients who were either getting assistance through SNAP or a local food pantry. Again, these are definitely big milestones for us in our first year of EPIC during a pandemic, right? For chronic condition, we enrolled 818 patients. So again, helping them to improve their chronic condition that's going from uncontrolled to controlled. Target 4, which was screening, we screened 1,350 patients to help them improve their social connection. And again, this is all with a global pandemic going on, so there aren't any face-to-face events that they can attend. But again, thinking outside of the box and providing virtual assistance any ways that we can to help promote social connection in that way. Thank you, Stephanie. Okay, so social determinant benefits for BCOM, and I think Major Moore can definitely go into more detail here, but again, it's been a lot of recognition among staff and providers that many health conditions and diseases can be improved by simple behavioral changes, and that goes along with our staff and some of our providers being able to refer patients to the outreach team, to the behavioral health team, for assistance in any way. Building community partnerships, that has been very, very big for the EPIC program. So along with the great work that we're doing here, we can't do it unless we have those strong community partnerships. That helps to assess and address needs for health services and social needs. And so this is something that's even talking about the relationships and building community partnerships. It's bilateral, right? So we offer referrals to our community partners, and so do they, in terms of being able to provide the service and definitely standardizing that referral system. And also developing health promotion strategies that reach into communities to improve living and conditions. So if anything, we know that through the EPIC program, we've been able to reach into our community and say we're making a change. And some of that has been through, listening to the population in which we serve and being able to kind of build that strategy out from there. All right. And this is all through the Humana Foundation. So Humana Foundation is our funder and has funded, and we're so very excited. We were funded for a second year of the EPIC program. And so by focusing on social determinants of health, some of the same things that we shared all throughout this presentation, the Humana Foundation aims to promote, more healthy days, encourage greater health equity, social determinants of health, such as asset and financial security, food security, social connections, again, all of which impacting overall health and well-being of the community in which we serve. And with that, are there any questions we would love to maybe discuss and take the time out to answer any?
Thank you, BCOM team, for your fantastic presentation. It was amazing to hear the story that you have tying that social determinants of health data collection and highlighting the value to your patients and outcomes related to that. I'm looking into the questions pane. So there's two ways you could participate. You can either put your question within the chat box within the question section, or you can also try to unmute if you'd like to ask the question verbally. And I'm looking in the questions pane now, and it looks like someone's saying that they don't have a question. They just want to say that this sounds like such a fantastic program and they loved to hear your story behind that. So thank you for sharing.
Thank you.
I can agree 100%. It is an awesome program.
Um,
We'll take a moment just to see if anyone wants to ask their question verbally. You can go ahead and unmute your line if you'd like to ask your question verbally for the BCOM team. Okay, so I'm not hearing any verbal questions. We will monitor the chat, so if any questions come through at that time, then we're going to go ahead and just send them your way to see if anyone has any further questions that might come to mind later on in the presentation. But thank you again for taking the time out of your busy days to share the story. We really appreciate it.
You're very
Thank you.
welcome.
Thank
so
you for
much.
having us. Thank you again.
I'm sure we'll be in touch to hear even more about what happens in year 2 of the EPIC program. So amazing work.
Awesome. Thank you. We'll be here.
Awesome. Great. So fantastic. So we're going to go ahead then and transition to our next health center spotlight. So I'm going to go ahead and transition the slides here. So now we're pleased to hear from our second health center spotlight, which is Dr. Kitterman from Community Health Centers of Pinellas. And he's going to share some of the techniques and tactics that they have had in place to help make some improvements on their child immunization measures for 2021. So Dr. Kitterman, the floor is yours.
Very good. Thank you, Stephanie. So a little bit of background around me. I'm a pediatrician. The Community Health Centers of Pinellas is in St. Pete, and I work at the Johnny Ruth Clark location. So back about 4 years ago in 2017, we were looking at our immunization numbers, and we really wanted to make a big change. So we created a team to develop a new workflow to try to improve these vaccine numbers. You can go to the first slide. So one of the most important things that all of the pediatricians and all the providers that are seeing patients need to know is the definition of what measure we are measuring. All vaccines are important, but specifically this vaccine that we measure is when the child turns 2 on their birthday, have they received all of their vaccines? So whenever a new pediatrician joins the team, at our monthly meetings, at our quarterly meetings, we review what is the measure being measured. So specifically, a patient has to have 4 DTaps, 3 polios, 2 rotas, 3 Hep Bs, 3 Hibs, 4 Prevnars, a Hep A, an MMR, a varicella, and then probably the hardest of all, 2 flu vaccines before they turn 2 to qualify for a compliant patient for this measure. So I work with the team that we have monthly pediatric department meetings. Normally they're 15 to 30 minutes the first Monday of each month, and I'm always allocated about 5 minutes to review our monthly numbers, talk about the pros, talk about the cons, talk about any new initiatives that we're doing. So we have a very fluid way to get our information to our pediatricians, to our providers, and to our medical assistants. The Community Health Centers of Pinellas really views every single visit as an opportunity to give a vaccine. There are very few contraindications for giving vaccines. So even if a patient had missed their 1-year-old visit, they come in for an ear infection, you can still get your 1-year-old shot. So every single visit, we're printing off Florida shot records, we're checking Interg for shot records, and if that patient can be vaccinated, we're going to give the vaccine. Next slide, please. So what do we use for workflow? What tools do we use to address this problem? So when we were kind of sitting in research and development, we thought the 2 most important times to look through our list to see if patients are compliant is somewhere after the 15-month visit. So you have 1-year-old shots, you have 15-month-old shots. So we run a 15-month list, and then we also run a 22-month list. This gives us enough time to find the patient that's not completed, schedule them for their 24-month physical, and get them up to date. And this is really a team effort. The person that helps us at the Community Health Centers of Pinellas, her name is Marty Folsom. Marty Folsom uses dashboards and Florida Shot to look at our patient population, does them by name and date of birth, searches their Florida shots, and puts together a monthly list that gets sent to me. I review the list, and then I delegate it to some MAs at Pinellas Park, MAs at Johnny Ruth Clark, or part of the nursing staff, so that we get these patients in. So this is before they're 2 years old. We are finding the people that are not up to date and getting them in. Another thing that has helped, we didn't initially do this one, but now we do this, recalling all no-shows under age 2. So if you're under age 2 and you miss an appointment, you get flagged in the system, our call center calls you back. And so you have to try hard to miss your appointments because we're going to keep calling you to get you to come back in. So those things are things that we do before they turn 2. The part that I use what's called practice analytics, and I take a look at every single non-compliant patient. So for example, for the month of June, there were 28 non-compliant patients. So I go through each and every one of their charts, trying to see why we missed them. So one person may just be a general anti-vaxxer, does no vaccines. That patient we're not going to be able to get credit for. But one patient may just have one vaccine documented incorrectly. It has the wrong expiration date, and I am able to work with the medical assistant to correct the immunization record so that we do now get credit for those immunizations. Another thing that we do at the community health centers of Pinellas is morning huddles. So, we start our day from 8 to 5. I meet with the medical staff at 7:45, and we run down the 25 patients of the day, and we highlight those patients that absolutely need vaccines. And that way, later in the day when we're busy, we've already done a full huddle, and we're ready and prepared to give those patients the vaccines. Next slide, please. So these are probably the most important things that we're going to talk about. So what practices do we do that other pediatric offices could also do that will help increase your numbers? So the American Academy of Pediatrics, all the data, all the research shows that the best and strongest way to help your patients get vaccines is by a strong pediatric recommendation. So I literally use those words in my office. I say, Zoe, this is your 6-month physical. Mom, we're all done with the physical today. Today we're going to get the 4-month shot. Those shots are X, Y, and Z. These are the most common side effects. The medical assistant will be in to give the shots. So we use presumptive language. We give a strong recommendation every time. The next, highlighted thing here, this took a little while to perfect, but we train our medical staff. So anytime the MAs see a patient under 2, they make sure that we make the follow-up appointment. So if we saw this patient for the 2-month physical, we're going to make the 4-month appointment following. If we saw a 6-month visit, we're going to make the 9-month following. So our MAs are well-versed and very dedicated to doing this every single time, making those correct appointments. Another thing that we do that's not listed here, whenever we have a new patient, we send a priority 1 task to make sure their vaccines get added into the portal. So we wouldn't want a patient to be up to date and then their vaccines just not be inputted. So all new patients, priority 1, their stuff is scheduled right in. So like I mentioned earlier, 2 flu shots are required to pass the immunization screening. So patients, once they get their first flu shot after 6 months old, they also need a flu booster if they're under 9 years old. So the MA staff has also been trained. So once the patient gets their flu shot at 9 months old, then they're automatically scheduled at their 10-month visit to get that second flu booster. And that has really helped increase our numbers for, getting our adequate flu vaccine. Like I mentioned at the beginning, fever, illness, ear infection are not contraindications for vaccine. So if you come into the office and you're a little bit sick, the provider can say, hey, you are well enough to get your vaccine, and that's what we've trained our providers to do, to continue to give the vaccines. Another thing that we do here that's not listed is because the measure cuts off right at 24 months once you turn 2 years old, we make sure that we schedule all of our 2-year-old physicals at 23 months. So that way, if they miss that appointment, they can come in the next week or so and still get credit for it. If they're just missing 1 or 2 vaccines at the 23-month or 2-year-old well child check, we can get those vaccines. So that's super important as well. Back in 2017, we came together, and when I reviewed a bunch of the charts, we couldn't tell if the flu was being offered and the parents said no, or we couldn't tell if we were out of stock. So I know exactly which dates we have the flu vaccine. So like I know we get them in September or early October, and we know they go until June 30th. So we continue to give the vaccine all the way until June 30th. That way you can get your second flu booster. And then all of our providers are trained to document in their note every single time flu shot not in stock or parents refuse the flu shot. And if you want to include a reason why, I also include that. But that is super important for my monthly tracking so that I can see, and we have proof that all the providers are offering the flu shot, offering the correct vaccines at every visit. Next slide. So what are kind of some things that we have learned with this practice? So the very first thing is at the end of each month, we break down why patients are refusing to get vaccinated. So the most common refusal at our office is refusal to get the flu shot. So for the month of June, the amount of patients for that was 43% of the non-compliant patients was because of the flu shot. Then there are three others that are relatively similar. We have general refusers, which is they refuse all vaccines, anti-vaxxers, whether it's religious or personal preference. That's one subgroup. Another subgroup is a non-compliant patient who missed many appointments. You know, you can see in our charting, they missed their 9-month appointment, they missed their 1-year appointment, they missed their 15-month appointment. Those are going to be documented as a non-compliant patient. And then late to care patients are patients who were not fully vaccinated, then they come and see us around their second birthday, and those are going to count against us. There's no way to capture and get those positive. We also, although very rarely, do have a provider missed opportunity. So maybe out of all these hundreds of patients that we see, a 15-month-old patient was not given their 15-month-old vaccine when they came in for an ear infection and it wasn't documented. So I personally send an email to that provider in a very non-punitive, like this is just for learning. And that way all the providers will understand if we do make any mistakes. So again, kind of the breakdown for those for the month of June. Flu refusers was about 43%, general refuser 18%, missed appointments 18%, late to care 18%, and then that one single missed opportunity. What I've noticed just in this area of St. Petersburg, we have a big pushback against the flu shot. A lot of the patients say, hey, my grandmother got it one time and she got the flu, so I'm not getting the flu shot. So what we try to do every time is a strong recommendation, try to connect with our patients and see their point of view, but still make the best medical recommendation that is to get the flu shot. And sometimes that helps. But again, it's educating patients and just knowing that not every patient is going to get it, even if you give them a laundry list of examples. But what we have done in the past is we have, a myth buster sheet for the flu shot. So we do talk to the patients about myths around the flu shot, and sometimes that does help. And then we also promote within the community in our waiting rooms, we promote how the flu shot can be helpful during flu seasons. We're always looking for new ideas. When we initially came out with the list of things we were going to do, not every single one of these we were doing. Other things we tried and it didn't really work, but we're always looking for new ideas. Any provider, any MA has an idea, we sit down, we try to see what we can do to make it work, and we try that. Meticulously double checking things is what you have to do whenever you're reporting all of these numbers to HRSA. So back in 2020, the way they documented the Hib dose, no matter how you documented the Hib dose, all you needed was 3. But now if you document the Hib dose incorrectly, if you accidentally document a 4-dose Hib, then we're not going to get credit for that. So when I do my monthly checks, I'll find 1 or 2 of these Hib vaccines that a year and a half ago was inserted incorrectly that we are able to fix and help that patient because they are adequately vaccinated, and this is just the proof that they are vaccinated. Another thing that I noticed, we'll go back one slide. One of the other lessons that I learned was, during the time that we really tried to focus on increasing our vaccine numbers, a bunch of things happened. So, the pandemic happened, so it's harder to get patients to come in. So we've been, navigating. We created a wellness center for kids only 4 and under, basically only for physicals and vaccines. So even when other offices were completely closed, we were seeing well patients and keeping them vaccinated, getting them vaccinated, giving the patients and parents access to care. And then also the other big pediatric offices in St. Pete. So there's St. Pete Pediatrics, there's USF Pediatrics, there's All Children's Hospital Pediatrics. All of them have recently decided to stop seeing anti-vaxxer patients. So we've actually had a big influx of more anti-vaccine patients, which has been difficult to overcome. But one of community health centers, you know, our mission statement is provide quality health care for all. So I think it's super important that we continue to see these patients that don't know everything about vaccines, and we try to, every visit they come in, try to help them make the right decision and get vaccinated. Next slide. So very similar to the last group, you know, we work very closely with our community partners. We have a children's mental health initiative. So those behavioral health specialists will see families that may not have a doctor, and then their first visit is with behavioral health, and then they refer to us, and then they come and see us, and now we have a new patient that we can vaccinate. On July 31st, we have a back to school care fair where we're doing physicals. You know, it's a community outreach project. We do vaccines in the office. And so that's one of the ways that we're reaching out. Surprisingly, this one works really good. Asking parents about siblings. You know, a lot of my patients have 3 and 4 kids, and I'm seeing the seven-year-old there for a physical. Mom's there with the 6-month-old, and I'm like, hey, Mom, is so-and-so up to date on their vaccines? Do you want me to check? Boom, I pull them up. Oh, they need their vaccines. I'll schedule them for an appointment tomorrow, and we'll get them vaccinated. So asking parents about their siblings. Last year, we worked through Publix, and we offered a $25 gift card incentive as soon as the measure was met. So once you took your 18-month-old shot, took your 2-year-old shot, and you qualified for getting all the correct vaccines, we gave you a $25 gift card, and I think that was, you know, helpful to parents. We have offices that open as early as 7:30 in the morning. Almost every office has late night every night, open until 7. So we're there early in the morning, we're there late at night, and then we also have Saturday access. So there's always a pediatrician working on Saturday. So I see a lot of physicals on Saturday as well that we're able to help get our patients vaccinated. So kind of in summary with everything, I think that the community health centers of Pinellas, my pediatric staff, my medical assistant staff, we are hardworking, well-trained, and the whole goal is that we want everyone on board to try to help our patients the best that we can. So we're continuing working with workflow, we're continuing throwing around new ideas, but we like our structure and we review it frequently to try to improve on it. You can go to the next slide. All right, so that was the end. Any questions you guys have? Any comments?
Thank you so much, Dr. Kitterman. That was such a fantastic presentation and so many great nuggets of information for all the health centers that are on the line and listening. I'm going to take a look at the chat box here to see if there's been any questions submitted. So taking a look here, it looks like we have a question from Caitlin Haggerty. She's asking, where do your medical assistants print the vax history from? Is it from the EMR or from the state registry?
So depending on the office, we do both. Some of the offices that their staff has a dedicated shot person, they put everything in Entergy first, and we do it from our system, so Entergy and Citrix. Some of the offices don't have a dedicated shot person, and we print off the Florida shot, and we look at Entergy, so you have to check in both places. So depending on the office, we do both.
Fantastic. Awesome. So I'm going to go ahead and also unmute the lines to see if anyone would like to ask a verbal question as well. So let's see here. Let's unmute the lines. Are there any other questions within the audience for Dr. Kitterman? The lines have been unmuted. We'll give folks a second there. I did see another question actually come in through the chat, and they're asking, is your state registry bidirectional with your EHR?
Yes, so recently our two computer systems are compatible. So 2 years ago, it was not bidirectional, but now it currently is. So what we do is when we give them their 2-month-old shots, we put them in our computer system, which is Intergy. Intergy automatically talks to Florida Shots and it goes in. But then for the Florida Shots one, we have to manually put them in. So from Florida Shot, we have to manually put those in.
Fantastic, thank you. The lines are unmuted, so we'll give folks a couple more minutes if they would like to ask their question verbally to you. I'm also seeing a lot of great kudos in the chat as well from your team saying you did a fantastic job on your presentation. So just wanted to share that too.
Awesome, thank you.
Hi, my name is Yvonne, and I'm calling from the Casa Family Health Center. And yes, your presentation was really awesome, so thank you for sharing. Immunizations have always been a big area of compliancy when it came to our quality measures. So what are you right now with your compliancy? What is your percentage, if you don't mind me asking, of your immunization?
Yep, absolutely. So before the pandemic, our goal was 70%, and we were above 70%. After the pandemic, our year-to-date numbers are 65.7%. And when I do it, it's mostly the flu refusers and mostly the missed appointments. And a lot of those missed appointments are because of the pandemic. So I'm really thinking that next year, the way the measures will be done, we're going to be back up into that 70 range.
Wonderful. Awesome. Thank you for sharing.
That's fantastic. Would anyone else like to unmute their line and ask a question verbally? Hey, fantastic.
So,
well, oh,
Stephanie,
go ahead.
I'll add one more thing. So I think the most important thing of all the interventions is making that follow-up appointment every single time. That way the patients are coming in, having some type of tracking list right before they turn 2, so the 16-month list and 20-month list, and then giving vaccines at every visit, even if they're a little bit sick, give the vaccines every time.
Awesome. There is another actual question in the chat. So someone's asking in reference to the EMR. So does your EMR have a recall system? So it sounds like you're using tasks for that purpose, but if you could elaborate on how you're using that recall within the EMR.
Yes, so we have bounced around using the EMR, and for a certain period of months, that's how it was put in. But we weren't necessarily getting exactly what we would want. It would call, they wouldn't answer, and then the patient wouldn't get rescheduled. So this was a personal reach out from me to have our front office staff, because you only have a few patients a day that are under 2, and we just made that a priority to recall those patients and schedule them to try to bring them back in. And then when the pandemic came, it was much, much harder to do that.
Awesome, fantastic. Any other questions for Dr. Kitterman? All right. Well, thank you so much for taking the time out of your busy schedule to share some of these techniques and help our health centers get in the mindset of what else they could do to improve childhood immunization efforts. So we really appreciate you taking the time to share this information with everyone.
Great. Bye, guys. Thank you.
Thank you. Awesome. Fantastic. So for the remainder of the agenda for this afternoon, we're actually going to go ahead and take a look at some of the social determinants of health, or SDOH resources. So I'm getting some feedback. I'm just going to really quick check the audio. Fantastic. So when we're thinking about the resources to review, there's a couple that we're going to take a look at. One of the things we mentioned in May's QTECH committee meeting is we were trying to find a way to help support the data collection aspect of things and continue our conversations related to that. So with that in mind, we want to continue the conversation by reviewing 2 different resources that have been published recently. And we'll start out first with the report that was released that talked about a learning collaborative that took place with some health centers around SDOH data collection and workflows around that. And then the second resource is a frequently asked document that we actually created during a past Health Center Spotlight on this topic. So without further ado, we're going to go ahead and take a look at the resource. The link is available within the PowerPoint presentation. So essentially, the report we're going to review first takes a look at some of the lessons learned, challenges, barriers, and sort of impact stories that are in place with health centers that participated in a learning collaborative series that was focused on screening methods and using outreach and enabling services to help address social determinants of health. So with that, when we talk about enabling services, we're meaning so much the non-clinical services that facilitate that access to care, some of which was described today during BCOM's presentation. In the report, one of the findings that they shared is based on the 2019 UDS report, more than 70% of health centers are saying that they're collecting those social determinant of health risk factors outside of just what's required for the UDS reporting. Of those that are, 36% of them are using the PREPARE screening tool. So PREPARE standing for the protocol for responding to and assessing patients' assets, risks, and experiences. So that was the most common tool that was reported. But of course, there's other tools that could be in that repertoire. So it could be like the ones listed here, whether it's WeCare or the Accountable Health Community Screening Tool, just to name a few for an example. On this screen, what we're taking a look at is the actual map. So one of the things that the health centers that participated in the Learning Collaborative was able to design was their own process map or change map in this case of what are some different areas to target. So it started out first with a problem statement, and then it looked at potential target populations, contributing factors, interventions, et cetera. And it went through this path until they were able to meet whatever that goal was at the health center. They all had their own unique goals in mind when they thought about how could we implement a social determinant of health workflow for data collection. On this slide, we're actually looking at an example in that report that you can find. So all the health centers that did participate in that learning collaborative shared their own version of that change map. So in this case, the problem statement for this health center was related to not being able to formally capture a lot of robust information related to social determinants of health in their EHR. And they decided to map out these different factors along the way to help make some improvements and get a process in place with the ultimate goal on the right-hand side being to implement some sort of standardized way of collecting PREPARE or any other sort of social determinant of health information in their intake process. Other than creating the change map, one of the other items that was discussed were some best practices that surfaced from the involvement in the learning collaborative. So we're going to take just a little bit of time to look at each of those. The best practice that they identified, number one, is there is no one-size-fits-all approach to the process. So through those change maps that were completed by the participating health centers, it showcased that there isn't a specific or singular case that would work across the board for all health centers because they're all in different variation of what their problem statements were. What did they see as an issue in their approach to implementing to the workflow? They also saw that there was just differences in the strategy. So how did they want to approach their process? Whether it was accessing resources, their current experience with collecting social determinants of health, or even their level of enabling services provision. So what kind of staffing was in place for that? And then, of course, some of the things that were mentioned even today by BCOM is the terms of EHR compatibility and how that could either find a way to work around to improve that process, or it could be a potential thing to consider as you're rolling out this across your health center. The other best practice that was shared was to emphasize the utility in the collection of social determinants of health throughout your implementation. So every role at the health center can find some sort of utility when in regards to the collection of the data for social determinants of health for patients. So one of the best practices that they shared in reference to that was always going back to the why. So as you're going through implementation, trying to figure out the why define it and document it so that you're able to find out the complex and interconnected health and social needs of the patients that you serve. So that's, benefiting you in terms of identifying potential opportunities to workforce development, to help educate your staff on the process and what it means to do the screening, what kind of in-house resources could you provide, or even direct connections to other community partnerships for resources if it's not in-house. In addition to that, it helps to promote health equity and immediate changes that could help influence the community, the state level, regionally, or nationally. And then, of course, demonstrates the value of the health center program in terms of payers and policymakers and making that a strong conversation at that level. The other item here for best practice number 3 was identifying the CHC workforce engaged in social determinants of health workflow. So this is actually essential to one of the things that really resonated me to BCOM's presentation, right? When Dr. Major Moore was like, I have the easiest job as a provider, it's really looking at the staff that surrounds the care team and enabling services or non-clinical staff, potentially for social determinants of health and how they can help support the workflow process. So it could be community health workers, outreach staff that could play a role in the process. And then, of course, the screenshot here is going back to the 5 rights framework that we've talked about earlier. So the right information, the right format, etc. So it's important to look at this and say, who should conduct the screening? How is it going to be documented at the health center? And then it's important to educate staff in their role throughout the process and how they can help. On the next slide, we're looking at the best practice number 4 that was reported within the report. So here we're looking at connecting the health center mission with positive community change. So knowing that you all serve as advocates for some of the nation's most vulnerable populations, it's looking at that correlation between the patient-reported social determinants of health and, of course, the larger system that could impact that. So in order to do that, then you're able to have better awareness of kind of what structural barriers might be in place to health improvement or patient outcomes, and find more information that helps you better support them in a proactive way, and finding ways to share that data to make some positive changes in the community, either locally, regionally, or even nationally as well. The 5th piece here is best practice number 5, assessing the overall value and impact of your enabling services. So being able to tell the story of how your enabling services or social determinants of health team is able to tell a story around patient outcomes, improvement in service delivery, or just overall quality of care. And being able to do that will help you to get either expansion of services potentially, or even other funding opportunities, similar to what BCOM was sharing earlier. Since they made such a fantastic progress in that effort, they were able to extend that EPIC funding for an additional year to continue that great work. So those are just some of the best practices that were shared. And of course, the link is available to you all within the presentation to take a look at. For this section, we're now going to touch on the frequently asked questions document that we were able to build. So before we take a look at that, we wanted to take a moment to thank Family Care Health Centers. They actually presented a health center spotlight on their social determinants of health workflow, and they actually participated in the completion of some of the FAQ questions and answers that are collected in the documentation. Because there was such great amount of discussion that occurred during that meeting, we wanted to make sure we had that catalog for everyone to look at a different time. Some of the things that we talked about in that FAQ document are the tools. So it could be Prepare, or it could be a combination of tools. Maybe Prepare and looking at some other tools they mentioned, the self-sufficiency matrix, or even looking at maybe if you're going to target this from a patient population perspective and maybe look at only pediatrics, there's other tools to help to support that implementation as well. They shared a little bit about their setup in terms of their team and the care team design around social determinants of health data collection. They also talked about ways to look at the future of evaluating the efforts of that team. So looking at potentially a baseline for the patient at that self-sufficiency matrix, and then maybe even potentially you could review that maybe 60 days after the initial assessment, 90 days, etc. But it was just some food for thought to share. Another item here related to the FAQ document is related to some financial interventions. There were some questions in the chat related to that, and the team had provided some insight of how they use gift cards, which I know was mentioned in both of the health center spotlights today. So finding ways to have that as an incentive to some degree for patients so that they can have access to certain needs. And then I think the two biggest things that were discussed was looking at provider buy-in. So making sure that the provider team and the entire care team have an understanding of what role that team for social determinants of health plays. So if there's that transparency where they're able to see as a provider what efforts or interventions are being done, then they're better informed on how those needs are being addressed in their overall treatment plan, which is fantastic. The last piece here is related to leadership buy-in. So thinking about how you can engage your health center executive teams so that the information can trickle down from there. So if you have a lot of buy-in from, let's say, your chief operations officer or your chief medical officer, and they're engaged in that process, then that can help make it even a more successful implementation plan as you think about how you roll this out. With that, you can also find opportunities to tie grant opportunities. So let's say you're able to find an opportunity to get some funding to help support the implementation of the workflow, then that could be a benefit as well in the leadership buy-in process. And then of course, the last thing here with buy-in is, again, thinking about the why the data is being collected and how you can sustain the services and the team that supports those efforts so it can continue over time. I will pause there to see if there's any questions in the chat. I'm currently seeing no questions. So with that, we're actually going to wrap up for this afternoon's QTECH committee meeting. A couple of different action items, which we'll review on the following slides, is taking a look at submitting your health center spotlight. We'd love to have your health center spotlighted in a future QTECH committee meeting. So we actually have a forms link here for you. So if you scan the QR code, you're able to submit your health center, your name, your email address, and then of course, what is a topic you'd love to present on. So it could be enhancing, using data to enhance value, like we heard today from Dr. Kitterman and what they're doing for childhood immunizations. It could be efforts around social determinants of health and your workflow at your health center for that. So there's a variety of different topics we'd love to have you highlight during this committee meeting. So take the time to sign up if you haven't done so already. We have some future webinar opportunities that are upcoming, one of which is the Social Determinants of Health panel discussion. So continuing the conversation on data collection and workflows and hearing some strategies from other additional health centers from the QTECH network and what they're doing in relation to this too. Some other key opportunities include a virtual clinical leaders mentorship office hours. So this is a chance for CMOs and medical directors to hop on. Dr. Tim Long and Dr. Warrior Esmond will be on to provide some support and have conversations around any sort of tough topics you may be experiencing within your role as a clinical leader. Other exciting news include our conference. So our virtual educational conference is going to be taking place again this year in October. So the link is now open to register. And with that, we actually have an opportunity to submit poster ideas. So if your health center is doing anything related to quality improvement, research, any sort of innovations and workflow that you want to highlight, there's an opportunity for your health center to do that as well within the virtual conference itself. So there's a couple details here. I know there's a lot of information, but of course this will be available within the slides so you could take a look. One last update, Clinical Leaders Workshop for fall session is up. The save the date was released and we will be opening registration soon. It will be taking place in November, so our fall Clinical Leaders Workshop will take place at HCN headquarters in Miami. So we'd hope that you have the opportunity to join us. And of course, thank you as always for taking the time out of your busy schedules just to meet with your fellow health centers within the QTECH committee, share your insights and all the fantastic work you all do on a daily basis. So thank you again. Have a wonderful rest of your day.